Design for Safety, or DFS in short, is the process of identifying and reducing safety and health risks through good design at the conceptual and planning phases of a project. Through early intervention, risks can be mitigated before construction and maintenance. The WSH DFS regulations is effective from 1st August 2016 and is applicable for all construction development with contract sum of $10 million and above. Under the DFS regulations, there are various key stakeholders who are duty holders with prescribed roles. They are the developer, the DFS professional, the designer, the contractor, and the registered proprietors. The developer is the owner and financier who makes major decisions in the project. The developer has to plan and manage the project such that sufficient time and resources are allocated for it. It is the responsibility of the developer to engage competent personnel and provide relevant information to ensure that foreseeable design risks in the project are eliminated. Or, if it is not reasonably practicable to be eliminated, the design risks should be reduced to as low as reasonably practicable. This can be done by convening the DFS review meeting and through the DFS register.
We will always allow sufficient time and cost allocation for constructing safely. And this manifests in how we tender our projects. We send out specifications with our tender documents which have a list of specific requirements that need to be met in terms of safety, and no matter where the project is, both here and overseas, those criteria must be met. So built into that process is the time and allocation, cost allocation for delivering development safely.
The developer may engage a DFS professional to assist him with his duties to convene the DFS review meetings and prepare the DFS register. The DFS review meeting provides a communication platform for the developer, designer, and contractor to review the design risks. During the meeting, the designer and contractor will have to inform the developer of foreseeable design risks. All crucial information must be recorded in the DFS register.
During my first meeting with the project team, I will include a briefing on what is design for safety, the roles and responsibilities for the various stakeholders, and the process for the DFS review. All our projects are on a compressed program, so be proactive. Discuss with the project manager or the lead consultant for the time to be allocated for the DFS review.
The designer has to ensure that he eliminates foreseeable design risks in his design. In the event that the foreseeable risks cannot be eliminated, he has to modify the design plan to reduce the risk to as low as reasonably practicable.
Designing on how the building needs to be constructed safely and how it's going to be maintained has to be looked into right at the beginning, at the design stage. Then we can anticipate what other things that has to be looked into instead of realizing it only at construction or only at when the building's already been done.
The contractor reviews the drawings to look into the foreseeable design risks and carry out the risks assessment to ensure that the risks can be mitigated. It is important that he engages competent designers and subcontractors for the job. He also has to provide relevant information to the people he engages.
By integrating the DFS in the design stage, all the benefit will be reaped through the construction phases. All the potential safety and health hazard will be reduced and mitigated. As a contractor who built the project, this is very important for me to look into the drawings and to identify all the possible design risks and do my risk assessment to ensure all the risks can be mitigated. To ensure the project progresses safely, this is important that I engage competent designers and subcontractors for the job, as well as ensure the relevant information for the job is passed down to them.
There are two key requirements for DFS: the DFS review meeting and the DFS risk register.
The DFS review meeting is when we gather all the relevant stakeholders, including the developer, the designer, the contractors, and maintenance staff, to discuss foreseeable design risks of a project. This includes looking at the risks posed to the worker constructing, demolishing, or maintaining the structure. During the project, it is important that information about design-related risks are shared among stakeholders. This is done via the DFS register, which is prepared by the DFS professional. This register should contain discussion notes for the DFS review meetings and information on the residual risks of the project. This information is then shared with various stakeholders of the project. After the completion of the project, the DFS register is handed by the developer over to the registered proprietor or MCST for safekeeping. The developer also needs to ensure that the registered proprietor or MCST is aware of the nature and the purpose of the DFS register.
With the information on the risks of the project, the MCST can inform the maintenance contractors when they are engaged for the cleaning or repair of the building. The maintenance contractors would then be able to take measures to mitigate the risks.
With the DFS register, we are now able to understand the risk involved in the project, and with this information, we can pass it on to our contractors, who are then able to use this information to take on their risk mitigation measures. For example, we have this green wall feature, which doesn't require them to work from height, and everything is all within arm's reach, and when they're traveling between levels, there's actually a proper cat ladder for them to cross between levels.
DFS will bring about reduced design risks, better coordination, and improved productivity from the start to finish of the building project. In future, workers can also maintain the building in a safer manner as they are made aware of the safety and health risks. With the collaboration from all stakeholders on DFS, we will be able to achieve zero harm and prevent all injuries. Together, we can achieve Vision Zero, a healthy workforce in a safe workplace.